Hello, my name's Susan. I'm from New Zealand. I work as an anaesthetic nurse back home, but I've been having problems with my knee for a couple of years now, and I finally went to see a surgeon over there. Unfortunately, I can't get into the public health service. We have a long waiting list there, and it was going to be about 2 years before I was going to get my knee done, which I can't afford to do. I need to carry on working. And so I looked at the private side of things and found it exorbitantly expensive, particularly as I had to pay for it myself. I read an article about a nurse that had gone over to India to have both the hips done for a considerably small amount of money. And so I made contact with her, and through her I found out about IndiCure. And I looked online and looked at the website and read a few reviews by people, and I thought, this is for me, I can do this. So I contacted IndiCure and they immediately responded. I was interviewed by the surgeon that I selected. We did FaceTime and we had my surgery booked within 2 weeks. I sent all over my medical documents and away we went. And since when I arrived in Mumbai, I found the driver waiting for me with my name and driven straight to the hotel. 2 days later, I'm in the hospital for all my tests, which were completely thorough all day long. I had the most intense tests that I would never have got back home in New Zealand for having a knee replacement. I had my heart checked, chest x-rays, blood tests, knee x-rays, you name it, it was done. And I was admitted to the ward, and the next morning I went into theatre, had my surgery under a spinal anaesthetic, but you can have it under general anaesthetic. The staff were amazing in there. I was treated respectfully and well looked after, and I had no complaints. Then I was put on the ward and I stayed there for another 4 nights. And during that time, I was taken out of bed on the first day post-op. I was on a frame for the morning, and then by the afternoon I was walking independently. Now at home, you would be walking with crutches for about 2 to 4 weeks. So I was absolutely amazed. Second day post-op, I was walking up and down stairs. I couldn't believe it. I thought this was not quite a miracle, but I knew I couldn't have done that at home if I'd had a knee replacement there. I had physiotherapy every day. I had the doctors visiting me every day. The nurses were exceptional. The food was fabulous. I had my own private room. I can't speak highly enough of the care that I've had in India. I don't think I would have had the same level of care as I would have in this country. I thoroughly recommend IndiCure. For anyone who's thinking and not quite sure about going overseas for their surgery, you will be in safe hands. The surgeon will advise you about post-operative care and recovery, and they give you the right medication to make sure that you go home safely. Any questions they will answer for you. Please don't be afraid to consider surgery overseas like I have, because there is an alternative to having to wait at home for a long period of time before you get your own surgery.